Good morning, Italian and Irish friends. Today, for the 20th edition of the series Incontri organized by italvideonewstv.net, we discuss an interesting theme: what to expect from the announced COVID-19 vaccines. And for this, we have two illustrious, shall we say, guests. Professor Mauro Adamo, Professor of Organic and Medical Chemistry at the Royal College of Surgeons in Ireland, and Dr. Arman Rahaman, a cancer researcher working at UCD, who actually runs a vaccine website called babyvax.net and has received awards for his COVID-19 outreach activities. So welcome on board. And the first question goes to Dr. Arman, in fact, for his link with the outreach activities on COVID-19. What is it exactly?
So thank you very much, Concetto, for inviting me here. So the thing is that when it started in March, I know that the social media actually erupted with information. And the horrifying thing was a country like ours. I originally come from Bangladesh. So there was this enormous amount of misinformation, and it's nobody's fault, because when you don't have proper information, it's very easy actually to generate misinformation. So that's what I actually came in because of my background in science and medicine. So whenever I read say for example, a scientific paper, what I did, I translated that and wrote into national newspapers. So it started like first my paper that got out, and then somebody invited me for the second paper, and somebody invited me for the third paper. So that's how actually I kept writing based on the scientific facts, and for that actually I noticed that I had to confront the misinformation. I give you an example. People actually in our countries, they started drinking ethanol, thinking that it would clear your the tract so that you didn't have any virus. So that kind of thing. It was a horrible thing, but it's not only one thing. There are a lot of, say, for example, misinformation about drugs, misinformation about treatment. So that's how
and I'm sure that amongst the misinformations was taking a leaf out of Donald Trump's book with the actual therapy which he suggested based on quinine, for malaria.
In Bangladesh, actually, people found it out. In not only Bangladesh, in many other countries as well. So they found it out that one of the components of chloroquine actually comes from a special seed that we used to use in cooking. So people started eating that because of the statement that came from America. So proper information, proper science-based thing. So that's the U.S. president definitely didn't help, but I think that this is the international phenomenon. People everywhere.
Yes, of course, yes. Now we go to the actual crux of the matter, which is in discussion today. We know, the public at large knows from television that there have been 5 vaccines been already discovered, or extracted, whatever. And some with a higher percentage than others of efficacy. But what to expect from these vaccines? First of all, do you think that they will help no matter what, even if there are collateral effects? And also, what do you think is going to be the timeline in terms of administering these vaccines? The general public in general, when can they get these vaccines, if you know anything about it? Start, Mauro, perhaps you can start answering that.
The 5 vaccines the most of the, let's say, lay public refers to is actually a small cohort of 11 of those which have completed phase 3. Now, The five, I would say, maybe restricted to one at the moment, because a full literature, scientific literature account, it's only available for one of those, which is the Pfizer one. All of the others are being claimed to be very effective, and the Moderna properly is as effective as the Pfizer one because they work under the same principle. But all the others have not been, in a way, subjected to the scrutiny of the scientific community. Having said that, timeline is really fast, as the Pfizer and the Moderna one are very easy to manufacture, very fast to manufacture. And that's what gave them also a lead in terms of applicability. I understand, for example, and I read the papers and I see there's a lot of criticism against those vaccines because they have to be kept at very low temperature, which is true. It's not ideal, but from the other side, they have been made quite significantly fast when compared to the conventional or other methodologies. I've been hearing voices that actually in the USA, the Pfizer one has been already started being distributed, and at least an infrastructure to keep it at the low temperature has been put in place so that this can be very fast and efficiently distributed in the next month. So it seems promising. In terms of side effects, Concetto, this is a jump in the dark, and it's a jump in the dark, and it's extremely unpredictable to say what is going to happen. When you go, there is one aspect that is related to drugs, which is pharmacovigilance, which routinely, even when a compound, a drug, has been introduced in the market, there is a system which is updating or feeding back the producer and the FDA or equivalents on the occurrence of side effects. And so this is probably what we're going to be seeing. And very likely this is going to be leading to the screening of the last one or two vaccines that will be ultimately used for a number of years. This is something that should be dug out and discussed also. If people and the lay public is convinced this is going to be sorted out and wiped out in just 1 year, it's just unreal. And probably Arman is going to like to make a comment on this. This is going to be kind of influence type of situation for a number of years from what I'm reading. There will be a mass vaccination, which will grant that nobody will die, or at least a significant proportion of people will be affected so highly as to have their life endangered. But it will require significant re-administration or probably variation of the vaccine through the years. So that's probably something that would be very helpful, rather than going into the details of what is the strategy behind one vaccine or the other one, which is probably very difficult to explain. But these aspects, it's probably very timely and very nice to describe to the public, because expectation and management of an expectation is an important aspect in any context of modern life.
And Arman, can you elaborate on this as well?
Yeah, I mean, absolutely. So Mauro actually have kind of given a kind of a broad background to it. So I completely agree with everything Mauro said. So if you look at, I mean, besides that, on top of that, if you look at Ireland actually has done a signing agreement with 4 of the companies. Okay, so the four companies that Ireland is getting at is, one is Pfizer, one is AstraZeneca, one is Johnson & Johnson, and another, I don't remember the name, I'll tell you in a minute. So So what Ireland is doing, Ireland is actually preparing for, I think, the Pfizer vaccine, which is a very temperature sensitive vaccine. And a aspect that one has to look here, what I think from my kind of looking in the field, is the price. Okay, so for example, AstraZeneca's price is £3, which is about $4 per dose. Whereas you have Pfizer's vaccine is about $20. Okay, and Moderna's vaccine is actually $37 per dose. So, and on top of that, you're talking about 2 doses here. But you see, Johnson and Johnson, their vaccine is actually a single dose vaccine, and which is a $10 vaccine as well. So, if you ask me, I have actually said this to a couple of other talk shows that I attended, that one should be pretty open to this field at the moment, because you don't know what is going to happen. Say, for example, we all talk about this, the efficacy and everything. Efficacy is all right, but these are all numbers. So for general people, if they don't get the vaccine in their hand, it doesn't matter how good the vaccine is. So for vaccination actually is one thing, and what we are talking about, the vaccine, is a completely another thing. So the logistics, so the politics that plays in, the economics that comes into it. So there are a lot of aspects of this vaccination that actually piles up. So it is not only, say, for example, what we're seeing now, that a good vaccine came out, that is not all. So there are a lot of other things that strategy that one has to put in place, so that general people actually would get the proper information, for example, and then they're gonna get the vaccine in right time. So in terms of timing, as you were discussing, I think a statement came from the minister here in Ireland that they're expecting actually a bigger portion of the population, say for example mid next year, even if it starts early next year or at the end of this year. So the how the government plans for the mass vaccination, that is, I think, a very important thing. So it is not only like the efficacy and the good vaccine. Yeah,
that's what the audience, people at large, are interested in, of course. I'm interested in when can I get mine, for example, things like that. But with all these imponderables that these vaccines have, what do you think? Do you think that they will be able to allow governments to open the society to a certain extent, and eliminate all these lockdowns? And to what extent eliminate these lockdowns? Is there a margin of safety to keep in mind, even when these vaccines are administered?
If you ask me, I'm actually it's a fact-based thing. It's a science, So you see that due to this current lockdown, which we are opening today, the number actually fell from 1,100, 1,200, like above 1,000 to where we are now, so around 200 or whatever it is now.
Yes.
So if people do not abide by the rules and regulations, say for example the mask, say for example the social distancing, if they don't do that, it's natural that the number would shoot up again. So I say that this is the information for general people here in the country, that they have to follow the stringent rules and regulations that the government asks them to follow. Because if they don't do it, you don't have to be a scientist, you don't have to be an expert. You know for sure that the number will shoot up again if you start doing the things that we have done, let's say last year. Especially in an occasion like Christmas is coming, it's a bad timing, because people would love to meet their families, and people would. So I see that certain amount of precaution is a must. Otherwise, the thing.
Yeah, but that is on a situation pre-vaccination. But once the vaccinations are performed, so change for the better, and to what extent, in society?
So, Mauro, sorry, go ahead.
If I can make a comment about this, there is one piece of information that both the politicians or the legislators and the scientific community is looking for from the producers, which is answering to the question whether or not somebody who has been vaccinated could be infecting other people. And this is an essential point, because if I am vaccinated and I'm protecting myself, but I'm still able to infect other people, then we need to wait until a very significant number or proportion of population is vaccinated before we have allowed to go back to normality. Okay?
Sure.
Even in that case, there is, in my opinion, a scientific approach to it, which is going slowly but steady towards the normality. We expect that after having the shot, we all go back to where we were in February 2020. They're wrong. It won't happen. It will happen, though, a progressive process towards normalization. So it's just going forth as steadily but slowly in such a way that if something appears again, can be managed in the most appropriate way. So that is the consideration to be made. We know they work. We know that people treated with those vaccines, most of them don't get ill, don't develop the symptoms at all. But what we don't know yet, if these people are enough to keep the virus away from the society, or if they can still transmit it. Until that is clarified, there is nothing that could be done, in my opinion, at least.
Yes. And so, Arman, would you like to come in on this?
I completely agree with Mauro, but just one thing that, all the things that we know until now, these are reports. These are, they're telling it to the journalists, this and that. So only way of knowing this thing would be when we get in our hand the scientific paper. So until that comes, a lot of these questions are actually unanswered for not only one, for all vaccines. So this is exactly, I agree with Mauro that we have to see which vaccine does what. And if we see that, the vaccine that we're giving is not actually, protecting us from spreading the virus, then of course we have to be extremely cautious. And vaccine, if I get the vaccine, I'll be protected. But then if there is a risk that I will spread the vaccine to somebody else, then one has to kind of think about what strategy to open up the country again. So I think that's what the point that I was making, that the total vaccination thing is a multi-parameter game. It's not only one thing. You understand? So one has to look at from above the policymakers to tell the people of this country that you have to do this, you have to do that. That just the strategic thing.
But everything going well in an ideal, hopeful, ideal world. When do you think that we could normalize? If these vaccines work and with due caution and still, to prevent. When do you foresee the actual end of this terrible situation? And also another thing, what about mutation of the actual virus? If in the meantime, while administering these vaccines, the actual virus mutates? Because as I know, as a profane sort of man in the street, so to speak, I know that they have this bad habit of mutating.
Yeah. So to answer your question, Concetto, is very simple. So the difference of these virus and with many others, because you know yourself that the virus actually attack with this only a particular place, which is the part of the protein that all the vaccines are being targeted, okay, the spike protein. So interestingly, the rate of mutation in this spike protein part is very low, number one, which is a good thing. And another thing which might be a little difficult for general public to understand, but let me put it in a simple form as I can. You know, sequence change doesn't mean the how the protein would look like would change. Do you understand? So that is a completely a different matter, actually, how the protein our body's immune system actually recognize the protein based on how it looks like, not on how the sequence is. Okay. So that's why I would say that, you know, people actually should not get too hung up on the sequence changing part, at least for these viruses. Yeah, it can be true. Say, for example, the influenza virus, we have a constant problem. So that's why influenza vaccines efficacy is actually around 60%. But this could not be the case for the coronavirus.
Yes, Mauro, any comments about it?
I completely agree, boss. Just want to point out one thing. I mean, when you mean normality, it depends what kind of normality you mean. Because
back to where we were.
Back where we were,
or almost.
Back where we were with traveling abroad, or traveling abroad,
freedom of
huge step. And just to put this in practice, imagine that we all Europeans vaccinate ourselves, and we are vaccinated in, say, 18 months. And then somebody, and I'm putting Ireland at the forefront because Ireland has a huge number of international activities or collaborations or services is provided. And let's say somebody like me who is a process chemist has to go and travel to India, or has to go and travel to Brazil, where most of the manufacturers of drugs are located. Now, this is quite a huge problem, and it would, depending on the fact if I am coming back positive, but I'm vaccinated, so totally asymptomatic. So if we don't answer that question first, the possibility of reintroducing back into the community something that we think we have eradicated exists, and it has to be managed approximately, properly, not in an approximate fashion. So traveling for work, in my opinion, never really stopped in many ways. And this will be going back to normality, let's say, pretty easy. Traveling for leisure is going to be a little bit more problematic, and it has to be elaborated about. But the good news, though, and it was something I would like to convey to the lay public, because otherwise it seems to be too negative about things in general. It's really a massive achievement and a great look that we were able to develop vaccines against COVID. I mentioned two things that are even more terrifying as number of casualties than COVID, which are HIV and malaria. And as far as people has tried the last 40, 50, 30 years one case, 40, 50 years the other one, we still cannot get a vaccine for malaria and or a vaccine for HIV. And so it's great that we do have this possibility for COVID. And I want to reassure people listening to us, saying that we as a humankind were able to achieve this in a very short period of time, and this will work. It will work. But again, there's still at this stage such a number of question marks that need to be answered that it's impossible to make predictions.
Only time will tell. Only time will tell. So we are reaching the end of our broadcast. So the final word to Arman, if you want to finish off. And thank you very much, Mauro.
Thank you very much, Concetto. I actually want to echo what Mauro was saying, that in order to come to normality, it is not enough that we vaccinate ourselves here in Europe. We have to vaccinate the entire world. So you know that there are a few endeavors which are going into that. Say for example, the AstraZeneca vaccine and few other vaccines, actually they're going after a not to profit kind of way. So that's why their vaccines price is so low, so that it can reach to rest of the world. So exactly what Mauro was saying, that I think the rest of the world should look into it, that it's not enough that only if I keep myself safe, I have to actually keep rest of the world safe as well. This is number one. So if we can do that, I see that after the vaccination in say 2 to 3 years time, we would get some form of normality. This is a kind of a positive thinking. Thank you.
But anything which will improve the situation where we are in now would be welcome. And with these words of good wishing words, I say thank you very much for your participation in this discussion, and maybe some other time we'll meet again on some other similar situation or issue. Thank you very much. Bye-bye.
Thank you very much.
Thank you, Arman. Thank you, Concetto. Bye.
Thank you.